Hey everyone, and welcome to this installment of the Future Grind podcast. I'm your host, Ryan O'Shea. Today we'll be speaking with Kevin Warwick. Kevin serves as the Deputy Vice Chancellor for Research at Coventry University and is known for his work with human-computer interfaces. He was a pioneer of RFID implants in the late 1990s and is perhaps best known for his BrainGate experiments, in which he demonstrated electronic input directly into the human nervous system, a technology which could pave the way for brain-to-brain communication. As always, show notes and more are available at futuregrind.org. We're also on iTunes, Stitcher, and wherever podcasts are found. You can also watch this on Facebook and YouTube. Make sure to subscribe, and you can also like, comment, and share to spread the word. This is Future Grind. So we are here with Kevin Warwick. Kevin, thanks for joining us.
Thanks, Ryan. Great. Looking forward to it.
So you have a long list of accomplishments, and you've participated in quite a few high-profile experiments. So how do you describe what it is that you do? How are you introduced?
Yeah. Well, I do quite a bit of speaking, mainly in Europe, but I get over to the US occasionally, and often they introduce me as Captain Cyborg, which is a bit of a fun thing because it was picked up off a news site where they gave me that title, so it sticks with me, I guess. But then there's the academic side, which is always quite nice. I can put my chest out a little bit and say I've done okay there. So I sit between the academic world and the hackers of this world, I think, really.
And what led you to researching the technological interfaces between humans and machines? Where does that interest stem from, and how did you end up on this path?
I guess I've always been interested in it. When I was a kid, my father had agoraphobia, and he's so bad, so he couldn't go out. He was stuck at home, and in the end they operated on him, literally cut out some of his brain cells, as he would have said, and he cured him. He just got over the problem. Suddenly he didn't have the phobia anymore. It's a highly dangerous operation, but it worked in his case. And that just led me to think, wow, look, you can change the brain slightly and completely change the person's personality capabilities. Then I read The Terminal Man by Michael Crichton. And that was all about pushing electrodes in people's brains and changing how. I think it was a psychopathic killer. I don't want to go into the story and spoil it for people, but it's a good story. I read it more as a science book, as I think you can with Crichton, and it excited me to the possibilities. And then later on, becoming a professor of cybernetics, which is all about humans and technology interacting together. So I was right in the middle of it, and we had an intelligent building. The building was set up more to operate on smart cards and for doors to open and lights to come on. But then there was the possibility of using certain technology as an implant. Not that it should have been an implant, hence I was taking a bit of a risk. So it was more being in the right place at the right time and having this background, part science fiction and partly an ill father, that pulled it all together.
Well, that's definitely a really interesting story there. And you first began experimenting with implanting RFID chips in yourself about 20 years ago, correct, in the late 1990s?
That's right, yes.
It's quite a leap from researching technology from a purely academic perspective to implanting it inside of you and becoming the experiment yourself. How did you end up taking that leap?
I think when it came to it, we had, as I said, the building set up as an intelligent building. We had the RFID technology. I mean, it was what we used was something that's normally implanted in a computer rather than in a human. So it wasn't ever designed to be implanted in a human. And it discovered afterwards that it broke quite easily. When it was implanted, if someone had come along and said, "Hiya, Kevin," and patted me on the arm, I'd have probably had pieces of electronics floating around in my body. But at the time, as you know, you take these risks. So it's having the right and really saying, okay, this can be a smart card, it can be external, but what about it being internal? And it was as much a philosophical, it's sort of thought-provoking exercise than anything else, I think. But then when it came to who was going to have the implant, realizing, well, if things go horribly wrong, if I've had this implant put into a student or some volunteer in inverted commas, then I would be responsible for them being, potentially, seriously endangered. So it was really down, if I want to do this, I'd take the risk myself. If something goes wrong, then people will say, what a silly idiot putting that in your body. And if things go right, people say, well, we know all that. It's obvious you can do that. So you don't really get too many plaudits for getting it right. And if it goes wrong, people think you're a real idiot. But I thought, let's go for it. But I didn't want to injure anybody else, essentially.
Yeah, that's a great point. Things can go wrong when you're doing experiments like this, and you also had to obtain ethical approval to even begin the research. So what was that process like? Was there a lot of pushback from the academic community?
Well, I have to say, when you're doing it for the first time, it is taking the risk because nobody's done it before and you really don't know how's the body going to react. I mean, you guys would find that with different implants. What's the body going to do, particularly if the material's a bit different, and how will the material react over time? You've got all sorts of questions. But I have to say, normally would get ethical approval. And when it came to what's now called the BrainGate implant, which I had later on, there was a whole lengthy ethical procedure in order to make that happen, which I can talk a bit about. But for the RFID, essentially just went for it. I went to my local doctor, my GP, and said, can you implant this in my arm? After he came down off the ceiling, he said, well, we worked out a way that he could do it. And he then afterwards, because it got a fair bit of publicity, he then received 2 letters from the equivalent of the General Medical Research Council, Medical Council in the UK. One was saying, well, you should have gone through these procedures to get ethical approval before you did this implant. You naughty person, don't do it again. And the other one said, congratulations, well done doing the experiment. It was a great success, and we beat the Americans, and et cetera, et cetera. So he holds those 2 letters almost the same day he received them from different offices in the same institution.
Oh, that's funny. You'd really think there'd be better communication within these organizations. But you mentioned BrainGate there, and that was a fascinating series of experiments that I'd really like to dive into further. And perhaps you can talk a bit about the ethics approval process for that as well. But really, I'd like to hear about this in your own words. So what gave you the idea for that, and what were you hoping to accomplish?
Yes, I mean, from the RFID, what we'd got essentially were signals going into the body that essentially to program the RFID, and then signals coming out of the body to transmit the code that was programmed effectively. And that's how the RFID works. And it was really the next step, saying, okay, well, if we're putting signals into the body, pulling signals out of the body, why not change the signals, have them dependent on what's going on in the body? Okay, we could have perhaps done that in terms of muscle signals, one kind or another, but really with the implant being available, what was then called the Utah array, which later became the main sensor on the BrainGate, as it was available, and it could be implanted into nerve fibers or the central nervous system into the brain directly. So we thought, well, let's go for that. We had a number of people on the team that knew something about the technology involved. We had various pieces of technology. A great guy, Peter Kybird, who had worked on a robot hand, which we could then link up to my nervous system effectively. So we had a variety of experiments that we could carry out. But principally, we had a team of 3 or 4 neurosurgeons who were interested in experimenting with the technology. So when we applied for ethical approval, we did so at 2 hospitals effectively where the surgeons worked, and they essentially, you have to fill in loads of forms, and we applied, myself and another researcher in the university applied with 2 surgeons as an overall team that was going to carry out the research on what's now called the BrainGate, And there was one question. We were using the median nerves, which are the main bunch of nerves going down the arm. And one question was, why don't you use the little nerve around the back rather than the median nerves? And we said, well, we need to show this is working and could be used for people that have their hand amputated and so on. So we had to answer a few questions, but it was just a laborious process, but they didn't say no at all. It was far from it. It was encouragement to go ahead and try it out and see how well it worked.
And there are a lot of different terms out there that people use to refer to this type of work, whether it's transhumanism, biohacking, grinding. How do you refer to this, and do you self-identify as either a transhumanist or a biohacker?
Yes, a very good question. I mean, I have to be a sort of an honorary biohacker, if not, an out-and-out biohacker, because in a way I respect what you guys do, what the biohackers actually do, because I've had medical attention all the time. You know, my GP's been involved, and then various surgeons involved with the BrainGate. So it's not like I have been just one afternoon pushing it in my own body or anything like that. There's been medical awareness of what I've been doing and support for the research all the time, which is probably not in the real biohackers ethos. But at the same time, the transhumanism, there are a lot of philosophers talking about what might be possible and what not. And I don't know that I really fit into that. I approach it very much, okay, yes, philosophically, but from a practical viewpoint, to say, well, look, technically, this is what we've actually achieved. This is what technically I believe is possible, a sort of hypothesis on technically what will be achieved. Now, if that fits into transhumanism, it's in a very technically oriented way. This is practically what we can do, rather than in terms of some of the more in the air philosophy that the transhumanists can come up with. So I know I do get categorized sometimes as a transhumanist or a post-human, or which may be right, may be wrong. In a way, I'm not really bothered what people call me. I enjoy what I'm doing, but it's always from a very practical oriented standpoint.
And another term that's often thrown around is cyborg. And this has many different definitions, and no one can seem to agree on a consensus about what it actually is. Some academics believe that we're already cyborgs, augmented by our phones and other devices. Others believe the definition is much more strict, and that the technology has to be directly integrated with and interact with the biological body. I know that some of your research is referred to as Project Cyborg, so what is your definition of the word, and do you consider yourself a cyborg?
Yeah, well, I mean, first of all, I appreciate that there are different definitions. Somebody riding a bicycle, it's an integration in some way of human and technology, or wearing glasses. But I go more for the science fiction oriented definition, I guess, which I would see to be, as you said, the integration of technology with humans in this case, but it can be the integration of biology and technology generally, but where it gives, for the human case, where it gives the human extra abilities beyond the norm, and that's critical. So I don't really see cyborgs where someone's got an artificial leg, although it could be if the leg is a Steve Austin type of leg. It's super powerful, or it can allow them to run 10 times faster than any human, then maybe it comes into the cyborg category. But it's more integrated technology, as you said, but making the individual go beyond the human norm, or allow them some sort of abilities that are beyond the human norm. And the sort of things I was able to do that categorize there, just take one thing, that I'd gone to Columbia University, New York. Sorry it wasn't Pittsburgh, next time. And we plugged my nervous system in the internet and connected up to Robot Hand, which was in the UK. So essentially my brain was controlling a robot hand on a different continent. I mean, it could have been in the lab, but when you over the continents, then people take more attention. So there was a bit of a publicity aspect just to show what's possible. But I was also able to feel when the hand gripped an object on a different continent. I could feel how much force, in a very simple way, how much force the hand was applying. Now, that's not a feat that regular humans have. So having an extra arm, in this case, on a different continent that my brain was controlling, essentially extending my nervous system across the internet, I felt were categorizing me as having some abilities beyond the norm due to integrated technology. Therefore, I defend my right to be a cyborg under those circumstances.
And both your work with RFIDs and the BrainGate experiment were just that, experiments, and they ended. Do you have any implants at this point, anything that you use in your day-to-day life to augment your capabilities?
I'm sorry to disappoint you, but they did. The surgeons left a few wires in when they pulled out the BrainGate, but they don't actually do anything. They sort of move around in my arm a bit and pop up, and I sort of push them back in, but they're not actually doing anything. So the strict answer to your question is no, I don't. I'm just, unfortunately to say, a regular human.
So you touched on this a bit, but what are your thoughts on the biohackers that are working with microchip and magnet implants and even more advanced powered implants in a non-academic, non-medical setting?
Yeah, I mean, in a way, I have to I'm supposed to watch what I say here, because I'm told you're not supposed to give these guys encouragement if other people go and take on risks and dangers. So there's that rider of how I'm supposed to reply. But to be perfectly honest, I look at it from a scientific point of view. This is a tremendously exciting field to be involved in, and it's very much in its infancy. It isn't really much in the academic world. We don't really have, maybe on the philosophical side, but we don't have all that many cyborg technology academic journals and things like that. It is a problem to get papers published in some ways. You're trying to find a home for them. But I think a lot of very respectable research is going on in the biohacking community, in terms of what the technology can do, in terms of how the body accepts the implants over a period of time, how well they work, in terms of what the materials are themselves and what happens to the implants over time. Now, often this is not because the journals are not there. This is not published directly in the academic journals, but it's great from an academic. We can look at the results that come out. Maybe we have to translate them a little bit into academic terminology that we can use, but the results are fantastic. There's not mainstream research, unfortunately, yet going on in the academic community. So the biohackers are providing something that is very, very much needed for, I think, in the medical world where bioengineering is going on. It's very useful there, but also for our work. So the research, and I call it research, that is going on with the biohackers. I mean, sometimes I think absolutely crazy what they put in the body. I think, wow, they really are taking on some dangers, some risks, particularly due to infection. So this is not me saying I fully endorse exactly what's happening, but whilst the work is going on, then there are results to be looked at and investigated and compared, and they're the best show in town. That's what's there. So great, long may they continue, and long may everything be okay. My worry is that sometime somebody may take it a bit too far and suffer the consequences. Fortunately, I don't think that's happened so far, but it might happen. So there's a slight worry in what I'm saying.
Yeah, I think I would largely echo those thoughts. One of my big concerns is there's currently a lack of regulation when it comes to self-experimentation with a lot of these devices, and my concern is that, like you said, someone will take it too far, or just by happenstance be severely injured or die in the process, and then regulations will clamp down in such a way that it'll hold this back for years to come because of strict regulations that are currently not in place. And there is certainly an element of danger inherent in this type of work, and I agree, there are biohackers out there that I see doing work either with non-sterile environments or things that have not been tested appropriately that kind of worry me a bit. But both you and many of the biohackers tackling these problems have understood and accepted these risks and are working within your powers to mitigate that risk to whatever extent seems logical. That said, how do we make use of this research in the best way possible? Do you have any thoughts on information sharing between your lab or other academics and the grinder community, or vice versa? How can we communicate and document this stuff efficiently for the mutual benefit of everyone?
Yeah, at the moment, I mean, I echo exactly what you said. There's not a word of anything that I would disagree with what you're saying. I've always taken great care when it comes to looking at the infection side of things, particularly, and in terms of operations, and had, as I said before, medical support for what I've been doing. But it's very difficult to know. We do push out and have pushed out in terms of the journals that there are reports on the research that we're doing. Although, having said that, on the BrainGate, yes, there's papers out there which are accessible, and I'm quite happy if anybody contacts me. I'm quite happy to send them copies of the papers and things like that. But for someone who's not in the academic world, some of it may sound a bit like gobbledygook, because you have to write in the nature of, if it's a medical journal, it has to be in that sort of terminology. If it's a philosophical journal, it has to be in that terminology. Probably extremely boring for someone who's not in that area, but that's how you have to do it in order to get the papers published. You have to write in the tenor, if that's the right word, of that journal. I mean, other than that, and I don't put much out online. My webpage is hopelessly out of date. Apologies for that. But other people do put information out there on what they're doing. Some people have blogs, some people put Twitters out, and it is difficult because we don't have a central repository. We don't have a central magazine. The biohacking monthly or something like that would be wonderful for this, that we could keep up to date, even if it was an online monthly page or two. So there's a challenge. If anyone's listening in and they fancy starting up something along those lines, then great. I mean, that's just what we need at the moment. But it would need to be quite a mixed basis. Some academically oriented, some, but people who've never done anything, never written much in their life at all. Because I think it is good, in order to reduce the possibility of there being problems, for people to share their information and to open up. I tried this worked all right, maybe you can try it as well. And because things might work differently in different people. Sometimes, particularly if you're looking to connecting up to the nervous system, and when you've got, everybody's is a bit different. So things might work well in one person, like the BrainGate for me worked fine, but for somebody else it might work very differently. It might work even better, or it might work worse, and hence having that experimentation reported on by different people, I think, is important. It is all self-experimentation, or largely self-experimentation, which is great to a point, but it's sort of a one-off all the time. Look what I've done, that's the nature of it. Whereas really what we need is a view, look at what these 10 people have done. One of my PhD students, Ian Harrison, he carried out a study on magnet implants, which I know some biohackers try implanting magnets. And what he did was take 10 people who had magnet implants and carry out a whole series of experiments with them, and then take 10 people who simply stuck magnets on the outside of their fingers, partly to see what's the difference between implanting it and having it just externally. That's what his PhD was all about. So he got some great results from that, but unfortunately there are preciously few experiments carried out in that way. It is mostly, as you're saying, just individual self-experimenters. So we need the report somehow.
Yeah, you mentioned finger magnet implants there, and that's a topic I'd love to get to in a bit, but first I want to talk a little bit more about what you just said there. There is an understandable skepticism in the scientific and academic communities about N of 1 studies. You need a larger clinical trial sample size than that to make any meaningful results, but when you're dealing with personal biology, a lot of times it is customized to the level of perhaps an N of 1. The same thing that works for one person might not work for another. And that particularly comes into the case when we're talking about another type of biohacking. Humans modifying their bodies with technology has been getting quite a bit of attention recently, but much of that recent press has been focusing on the biological side with gene editing. We have people such as Josiah Zayner using CRISPR to target the myostatin gene to promote muscle growth. We have Tristan Roberts using N6 to combat HIV. What are your thoughts on this biological rather than technological augmentation, and do you feel that one variety of biohacking has more potential than the other?
It's a very difficult question to answer. I mean, it's not my thing. I'm interested in the results and what the guys are doing on the biological side, but I wouldn't say that is the way to go. But neither would I say what we're doing. The biohackers, in the sense of the biotechnology link, is the only way to go. Both of them are really interesting, exciting ways to go, to push the biological side, to push the technological side, and so on. Probably, the combination of both is the ultimate. But I think both have. I wouldn't like to say one is better than the other. Both have mileage. For me, this is just my personal view, the biological side is much more, I feel, longer term. It's going to take a lot of years for genes to take effect, but that's just my take on it. Whereas with a piece of technology, you can upgrade, enhance, call it what you will, particularly the way that your body is functioning, within minutes, perhaps, but certainly within a short space of time. When I tried ultrasonic input, so this was signals, essentially we'd opened a port on the nervous system and plugged in signals related to ultrasonic sensors to give me a sense of distance, simply pushing the number of pulses, the frequency, I should say, of pulses, dependent on how close objects were. So the closer the object, the more electrical pulses. And the typical biphasic pulses, the positive, negative pulses that you get when you're stimulating nerve fibers or neurons. But it took my brain about 6 weeks to accurately recognize the pulses. But then when we did that experiment, my brain, it understood that's an object that is close by. But so that's just looking at it taking about 6 weeks for you to have a new sense. That was ultrasonic. I'm quite sure that if we'd have tried infrared or other sensory input, we'd have flicked to it straight away. So the big advantage of the technological version of biohacking is that it's not necessarily instantaneous, but you're getting a very quick upgrade. You're very quickly getting results. I mean, with an RFID even, suddenly you can get your car starts opening when you come near it. Well, that doesn't happen with the genes. If you did have something like that, it's going to take an awful long time for that to be manipulated, that it can alter things in anything like that, if you possibly could get a result like that. So it's much more instant, and therefore much more fun and much more dangerous, I guess.
So you mentioned there that during the BrainGate experiments, you experiment with ultrasonics and actually sending distance information directly to your nervous system and augmenting your abilities for extrasensory perception. We've done similar things in the lab with Grindhouse Wetware using implanted finger magnets and a device we call Bottlenose, which is a wearable that we would also put those sensors on, which translates the distance information to electromagnetic fields, which are then picked up by the magnet and in turn felt by your nervous nervous system through the sense of
Okay.
touch. So similar things like that. And magnets that we're experimenting with in the lab here are one of the most common biohacks, I would say, when people want to augment their abilities. And you mentioned some of your students working with them on their PhD research. What do you see as the interesting field of work there, and what are the implications of it?
Well, it is sensory. I've had 3 students altogether. Jowish was the first one, and then Ian Harrison, I said, and then Matt, who was an undergraduate student. So he was studying for his bachelor's degree. That we got into all sorts of ethical issues there. I think the university found it a bit difficult to understand why this undergraduate, but he was a guy that had all sorts of piercings and rings stuck in his eyebrows and ears and everything like that. And he found it quite strange to see what saw the university as something quite stuffy, saying, oh, well, we don't really think this student should have these magnets implanted. So he just went ahead and did it. He couldn't wait and then he could get on with his project, and he got some excellent results and got his degree and everything. So, but I think mainly what we've been doing is the sensory side of things, as you're describing there, looking at basic electromagnetism, but the magnet is in the person's finger, a little coil of wire around the finger, and then the sensor changes the electric current passing through the coil, so the magnet will vibrate more or less dependent, if it's ultrasonics, dependent how far the object is, if it's infrared, dependent how hot the object is. So it's getting which I think I'd say is pretty cool. It's not cool because it's hot, if you know what I mean, but it's getting a sense of temperature from a distance. So, you can scan around and say which person's the hottest person in the room. I mean, that's interesting because it's one of where you can see immediate applications, particularly in the military domain. If there was and this is maybe something that will change things if we have, I'd say killer apps. That's not a good way of describing it, but there are applications that suddenly are of interest. And this I think, just looking at that, if a soldier before they go into a room can actually scan around the room, literally push their finger around the corner with a sensor on it and scan around the room and detect where there are hot bodies, people, in other words, in the room before they go into the room, it could save lives, give them a distinct advantage over the opposition. So I think there are some really good applications, which, the magnet implant is not sort of serious surgery. It's something that could go ahead as because of the research that you guys are doing and has gone on. The materials that are used, particularly if they're sealed and everything, then are not really an issue now. So the operation of them, I think, is well worth researching. So it's extending the sensory input through, in this sense, feeling through the fingers and seeing what different senses we can take in.
Building on that, I know some of the research that we've done at Grindhouse recently worked with sending Morse code information through a finger magnet. So rather than having to look at your phone or another electronic device to find out who is talking to you or to get information, you can just kind of subconsciously, ultimately, get it through your finger passively. And that's one of the things we've been working on here. But since the magnet implants are kind of gaining steam, at least in the biohacking community, they don't seem to be something that you've personally experimented with, though. Is that something you're interested in, or why haven't you gotten one yourself?
Yeah, I don't know the answer to that. It is something I could. It's not out of the question by any means. In fact, as I said, three students of mine have done that. I think we have to have all sorts of problems getting papers published on the subject. Simply with the BrainGate, then medical journals and some philosophy journals and so on. And in the academic world, publishing is important. But with the magnet implants, it's particularly difficult for some reason. It just doesn't sit anywhere. We've ended up with good papers appearing in conferences that are not really the best because they're simply not the journals there. Submit them to journals that you think, yes, this is it's a cybernetic type of journal, just bounces back, this doesn't fit this journal. There's no home for it, so it's very difficult to do it. And I think that has, I hate to say it, but that has put me off to some extent. If I do the research, it's not. I'd have to just push it on the web. It's not going to get published academically, and therefore doesn't get recognized academically. There's very little, almost zero academic literature about magnet implants, how they work and how they operate and so on, and even with the different sensory input. So I think if it opens up a little bit, then yeah, I'd be quite interested to go for it. Why not? It's good fun. Ian had very accurate sense of distance to objects with the ultrasonic. So seeing the sort of results that you can achieve, it's very exciting. So yeah, I may well go for. I may come to you guys for a bit of help to going for it.
Well, we'd be happy to help you with that, but I certainly understand your reservations there, and it's unfortunate that that's the case. We definitely need to work as a community to address this problem and find an alternative method of getting this information published if academic journals just aren't giving adequate attention to this field. I know that Sam Harris, the well-known neuroscientist and author, has mentioned that he can reach many more people now that he's podcasting than he did through his published scientific papers, or even more than his best-selling books. So that could be one way to get these results out there. So I guess if you have any research you'd like to spread the word about, I'd be happy to have you back.
I appreciate that very much, and I have to say you're quite right. I mean, it's not just podcasts. The main media, I do get a little bit of coverage from time to time, and always have had one way or another, and that does get out there, whether it's a TV program or whether I think when I appeared on the cover of Wired magazine, which I do say is one of the accomplishments in life. I think it annoys far more people than you expect, though. There's a little bit of jealousy out there to why should he appear on the cover of Wired magazine? I deserve it much more than he does. There's an element of that which is quite funny, but it does appeal to, and it hits an awful lot of people. But in the academic world, publications are almost the be-all and end-all. If you get podcasts or magazines or TV, it almost is a negative. One of the things that I've experienced, some of the glittering prizes of academic life in the UK, that might mean becoming a fellow of the Royal Society, things like that. I say, well, they're not going to happen to me. I have to accept that because I am involved in this sort of research. And a bit like Sam, you're saying, I'd be interested to hear if Sam does become a fellow of the whatever it is, National Science Foundation, or because it for some reason you sort of step out a little bit from the academic world. So still have to publish the papers, but you don't get some of the plaudits that you might ordinarily expect, because the research you're doing is it's not mainstream, it's out of the box, and therefore other scientists simply don't recognize it. Is it really research? Is it really science? Because it's not published. It maybe is a podcast, and a lot of people can hear about it and read about it and find out about it, but it doesn't fit the mainstream academic. I know it all sounds a bit boring and everything, but unfortunately that's the way the academic world works.
No, it all makes sense ultimately. There does need to be strict peer review processes to make sure that the best science and accurate work is getting out there. But I guess we need to find the best balance there between getting research that is worthwhile published and making sure that it is both accurate and digestible for the masses.
But I think there's a lot of work going on in this field, even with magnet implants, that is academically okay. It has a lot of rigor, a lot of strength, but there's just not the place to put it. You can't. Yes, you can put podcasts. There is some magazine coverage and newspaper coverage and so on. But the IEEE transactions on magnet implants does not exist. Is the problem. And with IEEE transaction, there isn't anything. There's human machine interaction, but it doesn't recognize this sort of research that's going on. It's just outside the setup, the sort of list of topics that are covered by the journal.
Well, that kind of gets into my next question here. As I mentioned earlier, you first worked with microchip implants about 20 years ago, and today, while they're more common and have practical uses in everyday life, they've not gained widespread adoption and are still often seen as taboo. And you first did your BrainGate experiments in the 2000s, and now, roughly 15 years later, the team at Grindhouse Wetware is just starting to take the steps towards working with implanted electrodes.
Yeah.
Do you feel that progress has been slow, or was this timeline to be expected, and do you see this accelerating in the future?
Yeah, it is a lot slower than I imagined. I mean, I'll take the two things separately. The RFID, as you said, is about 20 years. I think, strictly speaking, as we're speaking, it's 19 years, but it's over 19 years. It'll soon be 20. And I thought it would be picked up. I thought there would be applications there. I mean, it's used in animals quite a lot, non-human animals, that is, for things like passport usage, which could be usage in humans, identification that could be helping you go from country to country in a much more rapid way. So there are potential applications there, but it still seems philosophically, mentally, for people to have these implants in their body still seems to be not completely socially okay. And unless that changes, it's still going to be sluggish unless there is an application which is deemed to be okay. With the BrainGate, there have, of course, it's been used, I don't know what the number is now, 6 or 7 people who are paralyzed, putting it in their motor cortex to link their brain with a computer terminal so they can they think about moving, which they can't do because they're paralyzed, but it does move a cursor around on a screen, or to control a robot arm, even to feed themselves. And it's excellent work. I mean, Lee Hochberg, John Donahue, these are some of the people that have been involved with that. And it's really, and I think University of Pittsburgh, there's some work going on. So I think there's excellent, but it's all for therapy. It's all helping people who have a problem, which okay is accepted. That's okay. But for doing it for more of an enhancement point of view, which for me, the therapy is great, but the enhancement side of things is even more great. It really opens up all sorts of exciting possibilities that we could change how humans, maybe into transhumans and so on, as we're talking about. But that's really where it gets exciting. And it's a great disappointment to me that since the BrainGate experiment that I did try, nobody has followed suit. So you guys have got to get moving, and just one person there trying it, be able to then compare results and say, well, you achieved this, Kevin, we actually got this result, which is a bit different, but this was, an ultrasonics, we got much the same. And then we start to get some sort of proof that says, yes, these results are, you can copy them, you can come up with very similar ones, they're reproducible perhaps, and maybe the dangers are not as great as we thought. People are not going to have problems with using this. And if the risks are felt to be less, then maybe more people will go ahead with it.
Well, yes, some steps are being taken in that direction here, so we'll look forward to updating you on that when there's something to say there.
Brilliant.
Well, you mentioned a few things there, that the move from therapeutic uses to augmentative uses, and I know that you've recently been working with some of the technology that I'm most excited about, and that is deep brain stimulation. I know that this has limited approval for therapeutic uses such as tremor, Parkinson's disorder, epilepsy, OCD, and a few others. However, I'm most excited for the uses of potentially improving concentration and memory, or to essentially turn off unwanted behaviors. So what is the nature of your research with DBS, and what are you working towards?
Yeah, I mean, what you're saying there is extremely interesting to me. I'll stop talking and you can get kind of talking there, but I won't. It's mainly working with surgeons at Oxford, the John Radcliffe Hospital, a consultant neurosurgeon there, Tipu Aziz, who is absolutely brilliant guy, and he is regularly implanting people mainly for Parkinson's disease, but also to some extent for epilepsy. I'm really not sure in talking to you whether he is done for depression and a few other things, but Parkinson's disease is the big one. But what we're doing there is this is for the the typical stimulator to overcome the effects of Parkinson's disease. But what we're doing is recording local field potentials, recording electrical activity in the brain, feeding it into an artificial intelligence system which learns to recognize for that person how the electrical activity links with the tremors and the muscle locking that you get with Parkinson's disease. But the big advantage of using AI is that it can predict when the tremors are going to start before they start based on the electrical activity in the brain. So the person themselves doesn't know that the tremors are going to start up until they get going, but the AI system can. It sort of can outthink the person's brain effectively. And what we're looking at is to help so the stimulator doesn't stimulate all the time, which is how it works at the moment, but just stimulates on demand. When the AI system says, okay, start stimulating, it gets going. So the person themselves doesn't actually experience tremors and muscle locking, which is much how the system works now, but it just stimulates when it needs to. But the other thing is, from the electrical activity in the brain, categorizing different types of Parkinson's disease. Parkinson's disease is just one big disease. Well, it's not really. There are different types of it, dependent on the electrical activity in the brain, and using AI again because it's good at classifying, so it can say, well, this person has got this type of Parkinson's disease or that type of Parkinson's disease, and the surgeon can then deal with them according to the type of Parkinson's disease they've got. So it's really using deep brain stimulation to provide information to an AI system which learns to categorize that person's brain, how the brain is working. So the AI system is modeling the human brain to some extent.
Yeah, I love that application of artificial intelligence. I'm actually the co-founder of an AI startup here in Pittsburgh based out of Carnegie Mellon University, which is using wearable devices to get physiological information from the body and then to predict and prevent opioid relapse for people who are in recovery. So by launching a real-time intervention when a craving state is detected, we're hoping to keep addiction relapses from occurring. And you mentioned another great use case of it there. So I love the thoughts of AI making sense of data from the human body and predicting our behavior before we're even aware that it could happen. And that's something I'm very excited about to see going forward.
Yeah, I mean, first of all, I have to say, for me, CMU is, in terms of how I am and my ethos on life and technology, CMU would relate most closely to that. It's a shame, really, we worked with Columbia for with the BrainGate and extending the nervous system across the internet, because it would have been really good to link with next time link with CMU. But I think there's a great mileage. It is initially for therapeutic uses, but I think the potential is there enormously for a whole wide range of things.
Well, we'll definitely have to get you associated here with some Pittsburgh universities and maybe even working with us at Grindhouse going forward. I'd love to see a collaboration there.
You've got it. I mean, do you think you guys will ever become, whether it's just an honorary part of a university, or is that not one of your ambitions at all? It's sort of your retro or outside the mold or whatever it is?
Well, for me, speaking personally, I am very interested in academia and working with universities and the research going on there. I know some other biohackers kind of resent the academic structure, feel it's kind of limiting and favors one type of learning or achievement over the other.
Yes.
I don't know that that's necessarily the case that I would see as it. So there's a lot of different points of view on it, but I think we need all of that. The plethora of people from various backgrounds working on this for the same goal is great. And anywhere that we can get support and help towards those goals, I would love to follow those paths.
Brilliant. I have to say one thing. I've talked about different things with the BrainGate, the extrasensory and extending the nervous system. But the thing for me you have a eureka moment, and I certainly had one with that, was when my wife got involved, and she had electrodes. I mean, this is microneurography, so she had electrodes pushed in from the outside, and then we linked our nervous systems electrically. So every time she closed her hand, my brain received a pulse. So it was like you talked about the telegraphy or telegraphic communication before. That was what we did, telegraphic communication from nervous system to nervous system. And really, I can quite see technically, okay, now let's do the same sort of thing brain to brain. Let's send signals from one person. Now, okay, it's extremely dangerous because we don't know how the brains are going to adapt. I think brain cells will go big time for it because it's a form of communication that will really open up the possibility of communicating just by thinking to each other. So I think brain cells will go. It may mean your brain then changes how it functions in different ways because it's into communication much more. But for me, that is the exciting experiment that the BrainGate really opens up, giving the opportunity to communicate in a whole new way.
So that's talking about a big potential for the future of brain-to-brain communication, which would really change everything about what it means to be human and how we interact with each other and our environment. So what would you say is the end goal of your research? Where do you see this going? How do you think this will impact society?
Well, I would love to be to carry out such an experiment. Obviously, it needs at least two people to be involved. You've got to, communicate. I don't think it doesn't have the same effect if you've got a machine and a human communicating together. That's one interesting point. But I think it is a human-to-human communication. And I think in terms of impacting society, just like the telephone or the telegraph had a major impact on how we communicate, even cell phones and so on now are the latest versions of that. And having moved on, I think connecting brains together in this way, even if it's a very limited bandwidth that you've got to start with, will completely change the way that we communicate. And in terms of the whole concept of post-humans and transhumans, that one thing above anything else, new communication, for me is tremendously exciting because with the experiments that I've done so far, I feel, yes, this is a practical reality. Yes, this is something that can be brought about. But at the same time, some people say, well, this is a bit scary, it's a bit risky. Yes, it is a bit, it's a lot scary and it's a lot risky because it's really a big step into the unknown. But that for me is something that will dramatically change how humans are and could be the app that brings commercial enterprises in big time, brings the big money there, which will push the technology forward at a dramatic pace.
You are doing a great job in this interview of segueing right into my next questions. You've done it many times, so that's great. So one of the questions that I'm always asked, and I'm sure you are as well, and I always hate answering it, is predicting how long until implants become commonplace. So I'm not going to ask you that, but I'm going to take another spin on that question, which is, these augmentative implants will never have a chance to catch on unless they are commercialized and made available. And you work in academia, but have you given any thought to the business potential of your work? Is there interest for you or anyone else there spinning something out of the lab and making it a commercial product?
I mean, there is, particularly perhaps for networking companies but I have to say the business is, I'm a terrible business person. I learned at a young age, if I could play cards with matches and I was quite good, but as soon as somebody put some money on a table, that's it, I would start losing big time. So I just stay out of business. I'm okay to help companies and things like that, but not directly to have or run a company for myself. So running away or spinning out, as you've said, from the academic world to start up a company and get a whole new communication company going, it's not really my thing. It's not that's not what I'm about. I'm interested, probably similar to you guys, in doing the research and experimentation and finding out the new results, taking one or two risks along the way, and so on and so forth. So, and as a result, I think there isn't really the commercial enterprise that's there picking it up as yet. For the BrainGate, it cost for us to do the experiment at the time, mainly for the technological development and paying people to work on the project. There were about 4 researchers working full time. It cost probably about $500,000, I would say, and mainly the funding came from networking companies. We also, I have to say, produced a little robot that was sold in a magazine, and that brought in a fair bit of money. So we sort of laundered, officially, okay, there's nothing wrong with it, but we laundered money from selling these magazines being sold with our robots in them, and used it on the project to do the BrainGate. But we had some networking company money, and Computer Associates, a software company, Nortel Networks. These were some of the companies that helped fund that project. So they saw the interest, but no company yet has come in big time. Maybe Elon Musk will pick up on it. He keeps talking about it, but he talks the talk, but he doesn't walk the walk, does he? Let's face it. But it'd be nice if he came in from a company point of view and started pushing things. That would move things forward, dramatic pace. But it's not my thing. That's just not what I'm about.
Yeah, that's the kind of position we're in as well, as we would love to do more research with this, and I would love to personally see it commercialized, but I think we do need some R&D funding, whether it's from companies or private investors or even governments coming in to see this through, and that's not currently happening to the extent that I would like to see at this point. So keeping an eye on the time here, I know we're running short, so this will be my last question here. You mentioned that you are working with a bit of deep brain stimulation. Is there anything else that you have going on that you'd like us to keep an eye out for, that you're particularly interested in, or even something that you're not currently working on in the lab that you think is a great area of study that others should look into?
Well, one thing I have, you've got the segue back for me now. One thing that I have looked at, and still it's a keen interest, is the other type of cyborg, and that is taking brain cells. I mean, typically it's from rat embryos, but you can also take human brain cells, culturing them, and after a few days connecting them up to a body, a robot body, and then seeing how the culture, which is then a brain, learns as the robot moves around. So the robot is a technical, it could be a simulation, but that's not so much fun. The robot is a practical physical thing that's moving around in the real world, and the brain is connected up to it via a Bluetooth connection. And then it's a case of, at the moment, the brain has 150,000 brain cells, which is not up to the 100 billion of a human brain. But to me, it's just a case of scale, although you also need to give the brain something to do, otherwise it'd be bored stiff and probably would not be much use to you. But that, I feel, is a different type of cyborg, where you're putting a brain in a robot body, and it raises all sorts of questions. Like, if you could have 100 billion human brain cells in a robot body, which I feel is technologically possible, then you're into the ethical question. Do you have to start giving it rights of some kind, and so the scientist can't just throw it in a bin at the end of the day? And does it get the right to vote in elections? And if it was in England, would it be stupid enough to vote for Brexit? You have those sort of questions. But no, seriously, I think it's an exciting research area where it is a little bit more in the academic world, but still I wouldn't describe it as mainstream. Steve Potter down at Georgia Tech, he's perhaps the world leader in the field, but there's not an enormous number of people that are working in the field, which is a great shame, because it is tremendously exciting.
Yeah, one of our team members here at Grindhouse Wetware, Lexi, she recently got a master's in the UK doing that exact thing of culturing brains for use on robots, and I know that's something that she is very interested in pursuing further and will be doing here with the team at Grindhouse. While that's not necessarily our expertise, I think it's fascinating and would love to see where that goes, and like you said, that brings up a lot of interesting ethical questions when it comes to a lot of people believe that consciousness is a product of the brain cells doing their thing. So when does consciousness arise, and how do we recognize that and treat it if it does? So fascinating stuff, and it sounds like we may have to have you on another time in the future for a second round of this, because bringing up consciousness and robotic brains right when we're ending is quite a cliffhanger for people.
Yeah, but you're quite right. John Searle, who's one of the key philosophers in the field, if you follow his philosophy, then these little robots with human brain cells, you have to say, are conscious entities. So, exciting world, and good luck to Lexi. Hope she carries on researching in the field.
Great. I will pass that along to her. Also, where can people find you and keep up with your work online?
It's a good question. Well, I mean, my email address is k.warwick and you either put coventry.ac.uk or Reading, which is spelt reading.ac.uk. So by all means, if you want to contact me and want to get some of the papers, go to that. My webpage, as I said, is hopelessly out of date. So the best up-to-date thing, if you believe some of it, is probably the Wikipedia page of Kevin Warwick. But there we go. I don't know that you can always believe what's on there. So.
All right. Well, sounds good. And thank you again so much for joining me on the podcast. And we appreciate it so much.
Thank you. It's been great fun. Cheers. Good speaking with you.
Hey, everyone. Ryan O'Shea again. And thanks for listening to my interview with Kevin Warwick. Don't forget to check out the show notes at futuregrind.org. Make sure to subscribe. You can also like, comment, and share to spread the word. We hope to see you next time on Future Grind.